My name is Linda Supplee, and I am the Chief Population Health Officer for Genesis. I've been with Genesis now a little over 3 years, and I really came here because I believe in the mission. And I believe deeply in the need for resources to exist in a rural community, and that we have to find ways to meet the needs of our population as a rural community. Population health is in many ways an idea. It's a concept about approaching healthcare in a broader sense, broader meaning outside what we normally consider care delivery. So if you think about population health, it's a combination of studying the population and certain subsets of a population, for example, the aging community, or discovering how many chronic diseases exist in a community so that we better understand the community, the population, and then we can identify what needs those populations have. So for example, a high rate of COPD or lung disease might indicate that we need more services to provide for that population. So once we identify the populations and the care that needs to be delivered to meet their needs, we also have to make sure that care is coordinated, that care is well understood by the individual, and that they have assistance navigating through their care. In addition to that, we have to consider things like social determinants of health. Those are factors that impact a person's health up to 70 or 80% of their overall health condition and their ability to heal from a disease process. So those items are things such as housing insecurity, they might be food insecurity, transportation insecurity that prevents people from achieving optimal health. So a food insecurity for a family might mean that they aren't able to have enough nutritious food to meet their needs. And if that patient or that individual happens to be a diabetic, for example, they can't manage their diabetes well without nutritious food. So we and the system-wide care management team support individuals by connecting them to community resources such as a food pantry. Another way an insecurity might exist is in the realm of transportation. So if a patient can't get to a doctor's appointment, then we have to help meet that need for the patient so that they can see the physician they are scheduled to see. The workforce wellness team is trying to achieve a deeper connection with our employers so that we can help employers keep their employees healthy and safe. So we provide support around not just workers' compensation, but overall wellness support for their employees by providing things like health fairs for their employees, and also helping them to connect to healthcare at a reasonable cost when healthcare needs are identified, so that employees aren't waiting to receive care. They can find quick connection and access to Genesis for the high quality, low cost care that we provide. Folks who are in their 20s, 30s, 40s often are working and they don't have a provider. They don't have a physician that they see regularly because they're generally healthy. And so one of the ways we want to help employers is to make sure that for an employee who doesn't have a physician, they have access to one very quickly. And that does allow employees to continue working, restaurants to stay open. We're able to give guidance to employers about what's safe for employees to return to work. And for individuals, I think it's about connecting them to healthcare. Very easy, quick access to healthcare for the individuals who are employed. What I enjoy about working at Genesis is the ability to bring all my years of experience in all the environments that I've practiced to bear on meeting the needs of our population. It brings me great joy to provide that to our community.